1876, it's time to get it done. We can't afford to run out of time during this legislative session. This is a critical step that the state needs to take in order to ensure health care in these unprovided areas where we have no health care. This stack of doctors' coats right here, they represent the many thousands of doctors that we need to fill those coats. 90 times the number of coats that are right here is what we need to provide health care in underserved and virtually no service areas across the state of Texas. 4,500 health providers is what's needed.
We've seen over the last 10 years a decrease in the number of medical students that are choosing primary care, and specifically family medicine. Many of these reasons that are given have to do with lifestyle and debt burden. The average debt for medical students coming out of school is about $130,000. And so the choices have been to go into residency programs that provide lifestyle and incomes that will help them relieve that burden. This bill would help to provide an escalated reimbursement for debt burden over 4 years that would provide $160,000 in debt relief over 4 years for health professional shortage areas.
This bill will draw, we hope, doctors, dentists, PAs, will draw counselors, all to underserved areas. And we know that tuition has gone up so much in the state. We are talking about what can we do about rising cost of tuition, of education. This bill will allow young people who are interested in going to medical school to have an incentive then to go and serve the neediest areas in the state.
We need desperately in rural Texas, and it's not a panhandle problem, it's not a South Texas problem, West Texas problem, or East Texas problem. It's a Texas problem to provide quality access of care to Texans around the state.
Well, we know that this bill would obviously be important for rural communities. I'm here from Houston today because this is an issue that impacts inner cities as well. Access to health care is actually a Texas issue. People think that since we're in Houston and have medical and dental schools in the area, that we wouldn't have any trouble recruiting providers, but we do.
With the way the economy is going, we're finding more folks requiring our services, and we'll continue to see that demand increase as our population ages. We need internists, we need geriatricians, we need family practice providers in the pipeline ready to serve our patients over the next several years. But now it's critical, and this bill would provide that investment which would yield a significant return that will reinforce the safety net providers like ourselves here in Austin, Travis County, and our colleagues in other parts of Texas.
When we talk to providers, by that I mean physicians, nurse practitioners, physician assistants, one of the first questions that they ask is, do you have a loan repayment plan? Are you on that? Are you able to get on that? And we can say yes, but then they've got to compete to get on those programs. This bill would assist with that, and it would help us to be able to recruit not just a physician or a PA or a nurse practitioner, but some of the finest ones that we could that come out of our medical schools.